Hello, everyone. My name is Vincent Gautret. I'm a director of CRDP for at least a few weeks. It's a pleasure to organize this Matinée de la Justice, which is one of the cycle of conference we have in CRDP. I'm very pleased to be here in McGill University with my friends of Center of Genomic and Policies. I just want to mention that historically CRDP is based on the Faculty of Law of UDM, but since 2020, 2 years ago, CRDP is now a recruitment stratégique with McGill University and with Laval University. It's a real pleasure to continue to have deep links with my colleagues of McGill. So thank you for coming. Thank you to, I think it's the biggest audience in person we have for the 6 or 7 conference we organized in a hybrid model. So thank you to be here in the room. And that's it. Thanks again. It's my pleasure to give the floor to Professor Rob Sladek. Thank you, Rob.
Thank you very much for coming today. Today for the conference on les matinées de justice, we're going to discuss justice and contact tracing surveillance. And as I guess we're all aware, we're living in a pandemic, and as a result, particularly in the times when we had no vaccines and no possible treatments for the COVID virus, approaches that protected the population through contact tracing and through surveillance to protect infection were extremely important. Today we have 2 speakers to discuss different aspects of this issue, and we're going to focus on several properties of these mechanisms for justice and contact, or for contact tracing, and particularly on the taxonomy of these methods, and looking at some of the concerns that they raise and issues, for example, containment for the virus and containment for the population, issues related to their efficacy, and certainly I, as a medical doctor, have some real concerns on how well these approaches could work, issues related to consent, to trust, to inequality, and really the question between whether these were adopted as coercive measures or whether these were adopted as measures for pure public health purposes. To discuss the issue, our first speaker will be Ignacio Cofone, who's an assistant professor and Canada Research Chair in Artificial Intelligence Law and Data Governance at McGill University here in the Faculty of Law. And this is quite a relevant person to be speaking, because while many of the early vaccine passports, if we think hundreds of years ago when these were done for the plague, or more recently when they were done for yellow fever, most of our attempts for looking at viral spread or controlling viral spread were based on paper. Whereas with the COVID pandemic, a great number of programs were developed related to using devices, smartphones in particular, QR codes and scanning. And these create some significant issues in terms of privacy and in terms of how data is collected and shared. Ignacio obtained a JSD from Yale Law School and a PhD in political science from Erasmus University in Rotterdam and Hamburg University. So at McGill, he's got a number of awards. He was a Norton Rose faculty scholar, and also received the Canadian Institution for the Administration of Justice Charles Gontier Fellowship. His research focuses directly on privacy and on decision-making to explore how law should adapt to technological change. So as I've said a minute ago, I think he's an ideal person for presenting many of the issues involved in these surveillance techniques. So Ignacio, the floor is yours.
Hi, thank you so much, Rob. And I think your summary of the issues of trust, pricing, and inequality was so good that I could almost leave. And you already gave the essence, I think, of the as you probably know, COVID-19 is really bad. And it rightfully has been occupying the minds of millions of people around the world, thinking about how to approach it. And within the range of policy responses designed to contain it, as Rob explained, one thing is unique to this moment. Mobile apps that can both certify immunity and trace close contacts that unlike the response to prior health crises like the Spanish flu, governments for the first time now are facing the pandemic equipped with data-driven technology that can leverage tracing and identification. This means two things. The first thing that it means is that contact tracing apps and immunity passes will remain a crucial measure, even if they're being rolled out in Quebec. And COVID-19 containment efforts are far from over, particularly in places around the world where sectors of the population refuse the vaccine. Omicron taught us that even a small proportion of the population refusing the vaccine can overwhelm the healthcare system and significantly impede containment efforts. And second, that every lesson that we learned from the COVID-19 pandemic will be useful for future global health crises. And I think that is one of the reasons why Visa very generously offered to organize this event. Containment may be necessary, and similar forms of containment may be necessary if new global diseases emerge, when new global diseases emerge, for example. So this is an opportunity to develop, I think, robust legal and policy frameworks that will be instrumental in the event that new highly contagious diseases come up and we have to address them. This said, activists know the dangers of these apps, so both and the risk of human rights that they're involve collecting, combining, and analyzing highly sensitive information such as data and location. And there's no guarantee that surveillance will diligently roll back, and no part of it will become a new normal. And our experience with measures against terrorism indicate that it is unlikely to be so. So what are exactly these apps and what are their most salient privacy features? Well, I think community passes and contact tracing together could be called containment apps because they both share one significant thing, which is that they tend to contain the pandemic. Because of this characteristic, these different containing apps, different types of contact tracing apps, and also different types of immunity passes introduce similar risks and similar trade-offs and call for similar best practices. So we can see these by classifying first contact tracing apps, so the first type of containment apps, according to their functionality. So whether they use location and proximity data and whether their data is centralized or decentralized. One key difference among contact tracing apps is that some of them use GPS location data, while others, like the one that was deployed in Canada, use Bluetooth proximity data. GPS location data is much more invasive and it's much more informative than Bluetooth proximity data, and it makes re-identification after anonymization significantly easier. And second, some apps store all collected data locally in each device, where devices are then used to match and identify contacts, while others transmit all data to a central database, which we can call centralized apps and decentralized apps. Now, most apps are Bluetooth-based, and around the world, they are decentralized Bluetooth-based. This was what made the Google App framework that came along so popular, as it was the case in Canada. But for example, Mexico's COVID radar is Bluetooth-based but centralized, and Argentina's Cuidar is GPS-based and centralized. So while in this 4x4 classification, the Canadian app presented the lowest level of privacy risk, the Argentine app, for example, presents the highest level of privacy. And that similar classification can be done for immunity passports. There are a few immunity passports that track location through GPS, and others, while technically they say they don't track location, they can track location at the moment that they're scanned, because it is possible to know in which places the immunity passport was scanned. And we can also separate immunity passports in centralized or decentralized in a similar fashion. So the rational response is to attempt to curb the risk while maintaining is consent, and the second one is anonymity. The issue with consent, as Rob already explained, is that it is hard to believe that there's meaningful consent to using the app, particularly for immunity passports, and particularly if social participation is made conditional on that. Even in the apps that seemed more optional and consent seemed to play a larger role, such as contact tracing apps, for consent to be valid, one needs to understand the consequences of the choice that one is making. And it is questionable whether the people that chose to use contact tracing apps around the world fully understood their functionalities, their surveillance risks, and the data that was collected by them. And the second one is anonymity. So anonymizing the data, particularly the data that goes to a central database for those who are centralized. And the caveat of that is that promises on anonymity in contact tracing and anything else always come with a caveat, which is that anonymous data doesn't exist. One can take out identifiers from data and then you have de-identified data, but it is always possible with enough effort to re-identify data and to re-anonymize it. So the question here is how valuable the data is and what are the de-identification protocols to know whether we believe that re-identification is unlikely. For example, in a decentralized system, when it's hard to re-identify because you have all the data together, and with enough security protocols, versus some systems that have all data centralized, so accessing the data would make it easy to re-identify, and for example, maybe track GPS that can be re-identified quite easily. So both of these guarantees, the consent guarantee and the anonymity guarantee, with varying levels of success are overall weak, but they're differently weak depending on the situation. It's really true that that's better for anonymity, and one has more transparency features. Surveillance produced privacy risks are not the end of the story. Depending on how apps they're used, they present an enormously important added risk to the distribution of their surveillance that magnifies existing inequality. So, for example, the elderly that live in care facilities, the homeless, migrants, refugees, and prisoners are conditions that make them more likely to contract the virus. Meanwhile, they also are the people who lack the means that will give them access to a device, to a smartphone, that can support the app to detect or report transmission, depending on the app that we're talking about, or to certify that they are immune. So those who are the most vulnerable to the virus because of their living conditions are precisely those who are less likely to own a smartphone that can support the app. This means that depending on how the apps are used, this creates new levels of a digital divide that inevitably deepens existing inequalities. Immunity passes in particular are another layer to this. So first, these apps will deepen inequalities because those with smartphones who have access to the app itself will have more resources than those without access to smartphones. But second, immunity passes is a great source of immunity. So if immunity passports recognize, for example, private antibody testing, they become a mechanism for access to public life or to travel, available only to those who are wealthy that can afford private antibody testing. If they're based, on the other hand, only on proof vaccination, they will trace the inequality inherent in vaccine distribution, which depends on how effective each government around the world is at ensuring widespread and free distribution. So the conclusion is that these apps will deepen and will not fix the consequences of any mistake that governments make in reaching marginal communities with their vaccination policies. So if they're based exclusively on vaccines, they will have a lower impact on inequality than those that accept other certifications, such as antibody testing or other kinds of private testing. And it will have a lower impact of inequality if they're implemented only after vaccines. So well, many containment apps that attempt to address these privacy and risks, and they do so with varying success. Well, it is impossible for them to eliminate the risk while maintaining functional use. This does not teach you what these terms are. So legislators and judges should be attentive and deploy efforts to curb these risks. Second, it means that effective policy responses require identifying the trade-offs that are inherent in this risk. So asking to what extent a specific contact tracing app that was designed and implemented in a specific country may help containing efforts versus the baseline of manual practices. Sometimes, to what extent that concrete app will do so against the what concrete immunity pass will do so against the asking to what extent the app this approach can assist governments in developing digital containment policies that encroach in privacy rights and in other human rights less. As such, these policies may be more likely to be widely accepted, which is also crucial to the app's efficacy. And lastly, another thing to take into account from there is that different apps lead to different level of encroachments in these rights. And these may inform functionality choices that policymakers make, making design choices for each app. So Bluetooth, as we said, is less interested than GPS data because it does not reveal the person location history and makes it more difficult to infer other person. Lower impact on privacy is achieved by avoiding storing unnecessary information, such as GPS location. In the case of vaccine passports, well, all information except for the vaccine record itself is properly centralized. Similarly, centralizing all information is enormously consequential because it increases the identification risk and allows for information. So these options that seem quite technical and maybe seem minor have enormous consequences for privacy, for discrimination, and for inequality, while all allowing different ways for the app to be functional. So the identifying data is important, but it is also important being aware that doing so is not a fail-proof privacy guarantee. And apps should work on a decentralized system. They should use the least invasive data that they can, so for contact tracing as proximity. And they should have, ideally, clear sunset clauses, both for the app and for the collected data that give us an indication of when the surveillance that is deployed will be reduced. And this consequence also extends but a trade-off approach is also useful for individuals. Many people do not use containment apps because they do not fully understand the privacy risk or because they believe that policymakers have not yet addressed this risk appropriately. And a fuller understanding of trade-offs can help people in their individual decisions. And selectively turn Bluetooth off or GPS off if that's what it's based, to avoid disclosing information about their location or the people that they see that they would rather not. They can make sure they understand the working of an app to weigh the costs and benefits of using it, and they can be judicious about drawing inference about others based on their app usage. So developing a nuanced approach based on these trade-offs is useful, besides for policymakers as for individuals in navigating a polarized debate. So in sum, if you remember one thing from this talk, it would be ideally that because contact tracing apps and immunity passes both rely on surveillance to monitor and contain the spread of the pandemic, they share these key considerations regarding privacy and inequality. They present important benefits for containing the spread and reopening the economy, but their surveillance also introduces human rights risks that must be considered and reduced, both at the policy and at an individual level. And the responsible reaction is to do one's best to identify and to mitigate. So thank you so much. I'm happy to address anything in the Q&A, and thank you for your attention.
So in the second half of our talk, I'm going to invite Dr. Zawati, who's a professor in the Department of Human Genetics at McGill, to discuss some of the issues which Ignacio has raised. And I guess when we think about these applications, and I think we've been given a really nice taxonomy of them and the major ethical issues that are involved in handling or thinking of these, we also have to think about uptake and whether the people who are going to use these applications are going to accept them. So to discuss further these issues, Zawati is a professor in human genetics at McGill, and he's a member for the Center of Genomics and Policy here, which is one of our groups that looks intensely at ethical issues surrounding medical research and medical care. His research concentrates on the legal, ethical, and policy dimensions of health research and clinical care. And he's got a special interest in biobanking and data sharing, as well as in the use of novel technologies, whether these be sequencing technologies or electronic technologies in this case, in both clinical and research settings. So Man, if I could ask you to come and speak. And I should just mention for those of you who are online that we will be having a question and answer session at the end. So please post your questions in the chat and we'll be happy to discuss them. Thanks.
Thank you very much, Professor Sladek and Professor Cofone for the great presentation. Just before I start, I just want to thank the organizers of the meeting and especially our colleague Vincent Gautret. It's been a pleasure working with you at the CLDP, and I know it's the end of your tenure, but it's a wonderful and constructive tenure, so congratulations on that. We still have you for a few weeks, so we're going to try to maximize on this. My response is going to be brief. I'm just going to, if you allow me, I'm going to share my screen. Yes, so just a few points that I would like to bring up in the conversation. One of the really interesting points in the presentation, but also in the great paper Professor Cofone has written on these issues, is the question of proportionality and the balancing act, which I feel, has faced some really interesting challenges in practice. For example, what the idea is to have one of the least restrictive policies and uses, and when we are trying to contain, but we found out that, the immunity passport or the vaccine passport were actually not implemented in certain places, but curfew was at very important junctures. And we've learned about that, of course, because there was a discussion around almost a punitive, sort of tax for people who are not vaccinated. And then, scholars and a community, came back and said, well, you have a vaccine passport, you have not used it in different places that you may want to do that. And then that became kind of an alternative to it, the expansion of it, which was possible before. But then we've also used something that is more restrictive in terms of transportation or when it comes to moving, which is the curfew. And when you're thinking about proportionality and you're thinking about its implementation in practice, you would hope that there is some evidence that's basing it. And there was actually an interesting Radio-Canada paper investigation on that, where the discussion around curfews was done almost a day before the actual press release. And they didn't have necessarily studies within that short notice, but they sent the director certain papers that were written on that. And I was very interested, to look into that a little bit. And I looked at the press release, and one of them actually was a paper from Jordan, which is a country that I hail from originally. And that paper was saying basically that when you isolate people, the numbers go down. In terms of the data, there were some caveats and some questions around that. Of course, if people are not able to move and leave their homes, they're not going to be able to get tested, and therefore we're going to see the numbers go down. But the paper itself did not mention something that I anecdotally know, which is that hotels and resorts in Jordan had special fares for families and friends before the curfews were implemented, so they can all go together and enjoy, a stay, which is basically the contrary of what you are trying to achieve with the curfew system. And when we're thinking about contract tracing, I mean, some of the papers that are written on this, we're talking about the mathematical modeling of these automated contract tracing. And they said there are really two factors that are absolutely critical and crucial. The first one is population uptake, and the second one is timeliness of intervention. So if we think about uptake, we have Canadian app. It was downloaded more than 6 million times, but actually very few Canadians use the app to report positive COVID-19 results. Actually, only about 4% of infected Canadians use the app as intended. When you're thinking about how useful would that application be, it's extremely low. And the reasons for that are multiple. I mean, sometimes people had a potentially wrong sense of comfort and feeling. If they were, for example, vaccinated, they say, well, I don't need to use that anymore. I'm protecting myself. Sometimes it was issues related to the actual process of getting those keys, and people were a little bit, kind of worried about that. And felt that it was too complicated, but there was also questions of trust surrounding that, as it was mentioned in the presentation by Professor Cofone. And the other issue is, from an efficacy point of view, when you're thinking about these, you have that centralization versus decentralization discussion and debate, especially for contract facing, but how effective can it be for timely interventions? And a really important distinction to make is between contract tracing, which is the kind of the traditional way of looking at it, versus proximity notification. And it's not the same thing. And I think some of the issues in this balancing act that needs to be made, I think from what we're seeing, affected the efficiency or efficacy of it, more than anything else. But the point I really want to spend just a few minutes talking about is, if you're thinking about these containment apps in the largest sense, there was actually other efforts that were put in place other than the contract tracing ones and the immunity passports or the vaccine passports, is symptom checking. And public health authorities and even private entities around the world have created and developed symptom checkers intended to assist individuals in monitoring their health and to evaluate whether they might have contacted or contracted COVID-19. And these symptom checker apps are not new. They have been there before the pandemic, and they're absolutely going to remain after the pandemic, but have largely been unregulated as a system, and not very scrutinized either when it comes to the major issues that we have been talking about for contract tracers or for immunity passports. Just a very quick note, it was a symptom checker app in the United Kingdom that provided the earliest evidence that loss of taste and smell might be a symptom of COVID-19 infection. It's published in Nature Medicine. But again, coming back to symptom checking, unlike contact tracing and immunity passports, they have significant application beyond the scope of the pandemic. And they can also be repurposed to assess for a whole range of conditions, from influenza to cancer. So they're not really limited to that. Many of them actually were there before and decided to add a new function for COVID-19. And of course, they're getting more data. It's identifiable information. It can also be linked with other information around medication, information about your medical conditions. Some of them provide resources. Some of them link with institutions and hospital institutions. But there are also other issues that are important to talk about. I'm just really keeping in mind the taxonomy and the categorization. If we're looking at those that are from the government, they're web-based and they're app-based, and then you have some that were done from the private sector that were web-based and also app-based. Some of them use machine learning technology like Ada, for example. WebMD is web-based, but it's also app-based. Again, they were used for containment purposes. but the issues remain. I mean, the issues around accuracy, the issues around trust and quality and consent remain for these apps as well. The different issue is that they have not been as scrutinized as the other apps, and they were not part of the debate as the other apps were. When we're thinking about consent, for example, many of them have very contradicting information when it comes to the type of data that can be used, the type of, or the uses, the possible future uses of the data, who has access to them. This is just one example, and it could be part of the terms and conditions of a document. It could be part of the authorization form that they sign. Accuracy, well, I mean, again, you're using applications that are supposed to be providing you with some sort of risk assessment, but they're not diagnoses. Many of them have disclaimers that say that you should be contacting your physician. This does not replace it, but they're providing you, almost everything that relates to the general jurisprudential definition of what a diagnosis is, which is if we look at it, in the largest sense, it is the connection of a symptom to a condition. And also many of these applications are not based in the same jurisdiction. They can be provided or developed in other countries around the world with experts from other countries in the world. And they are basically used for consumers who are in Quebec or in Canada. Questions of trust, I think, are given. Questions of inequality, especially around access to these applications and the capacity of individuals to be able to use them appropriately. But I think the one of the major points that I wanted to mention here is the staying power, as Professor Cofone presents it, which is, though many of those contract tracing and immunity passport apps have already started to be discontinued here and another jurisdiction, to the public's receptivity to the imposition of similar measures in the future. And symptom checker apps, in contrast, are there to stay. They predate and are likely to outlast the COVID-19 pandemic. And seeing them, as generalist products is also very important, because they're not specifically designed to address COVID-19. And so their staying power is going to be much more significant. And as mentioned, they are not, regulated. There some of, most of them at least would not fit under the general definition of a medical device, software as a medical device. Professional associations have been, cautious. Some of them have, at the Canadian level, instituted some guidance for some of these apps when they are suggested by a physician, but not necessarily when these applications themselves are being used without a physician involved. And again, given the fact that they were not generally created to deal with COVID-19, but basically promoted as a potential mode of addressing the pandemic, what we're going to see is that the symptom checker apps might have become further entrenched and will continue to have a significant feature of remote healthcare access in years to come. So a lot of questions on that particular point. If we look at containment apps in the largest sense, some of the issues that we discussed, which are consent, accuracy, trust, equality, and staying power, will remain. And the big issue that we also have is in the way we think about regulation, because if we only going to think that it's going to come, for example, from Health Canada, or from regulatory bodies, that will likely not happen, because they're probably going to take a risk-based approach to these applications. An application that will calibrate the level of insulin in my body is probably going to get more attention than one that's going to tell me, if I should be wearing sunscreen based on my genetic makeup. And I'm not making this up. There's actually an app that basically collects data from DTC companies, direct to consumer genetic companies, and basically tells you whether or not you should be putting more sunscreen on a sunny day versus a cloudy day. And I think what it calls for is, of course, more information to the public, more education, but also a multi-layered approach to regulation, which involves the major stakeholders. And I think here professional associations will have a very big say in all of that. Thank you very much.